Hey everybody, it's Lisa from Lisa Bug Fitness and Yoga, and today is a big day. It is November 18th, and I am exactly 2 months post-op from knee replacement, which I had done on September 18th. So I just wanted to give you a little update. I think, as Dr. Mayer said, after the first 2 months of being really difficult recovery, that I'm seeing a little bit of turn in the corner. So anyway, I'm going to have a seat here just to show you how well I can bend my knee. Whoa, look at that. But yeah, it's been a super hard recovery, and I went to Dr. Mayer for my 2-month post-op, and we're chatting, and he said, you have to remember what a big correction that you had in that valgus knee. And I told him I'd just been a little bit frustrated in my recovery and my progress, and he said, don't be so hard on yourself. You're really right on track where you need to be. So that made me feel a little bit better. I'm seeing some improvement in my bending, a little bit in my strength. That's coming along really slow. The quad is really weak, and the quad gets really disrupted during surgery. So they actually, when they cut in the medial part of the knee, they've got to invert the kneecap to get on the underside of it, to shave off the arthritis and to apply a prosthetic piece in there, a little button piece. So when they take that kneecap and roll it over, the medial quad really gets stretched and traumatized. The quad also gets traumatized from that tourniquet that they place around the leg and squeeze really hard so you don't have bleeding during surgery. So also the nerve block disrupts the quad, and so it's really weak. It's 60% weaker than the other leg, and for nearly a year, it will take 1 full year for me to get the strength back. So because of that, I'm still walking with a cane. I still have an occasionally buckling of the knee where I'll step forward and my knee will just give, and that can cause you to lose your balance and even fall. So I'm being really careful with that. But he said, just keep working at it. It'll come along. So he has released me from physical therapy, but I do have one more appointment on the Monday after Thanksgiving. So I'm going to go back and see my PT one more time after that. I saw her yesterday. And Dr. Mayer, I told him I was having some trouble with inflammation. The knee gets really hot. Even after I ice it, I can feel coolness around the lower and upper leg, but my knee is just on fire even after icing it. So I said I'm struggling with inflammation, so he recommended a 15-day taper of prednisone, which is a strong steroidal anti-inflammatory. So I said, let's try it. So this involves taking 60 milligrams of prednisone for 3 days, going down to 40 for 3, 20 for 3, 10 for 3, and then 5 milligrams for 3 days. So I've just been on that about 3 days now, and boy, can I see an improvement. Matter of fact, when I was at PT yesterday after doing the leg press, my physical therapist said, whoa, I see the veins in your knees, and that was something brand new. My knee has been so swollen, and even my lower leg, the calf, has been so swollen. And I woke up this morning and I can see veins in my shin, which I have not seen for 2 months because this has just all been so puffy and swollen. So the prednisone is doing its trick, and it's calming the knee down. It's helped me get a little bit more flexion. So when I went to PT yesterday, my active flexion, which was about in a week and a half since I'd seen her before, went from 106 to 115. That's huge. And that's the amount of bend that I can get on my own, pulling it back on the table. So that was a lot. And then my passive flexion, the amount that the cranking knee machine can do for me, went from 115 to 122. So I'm really pleased with that. So I think I'm out of the woods. I know I'm out of the woods for needing any type of a manipulation to get my knee to bend more, and I can just keep working on this on my own and also working on my strength. So things are turning around. I'm doing much better. I think maybe I'm going to try to head down to Florida sometime the middle of the first week of December. I've got a few things on my plate that I need to get taken care of, and I'm a little bit worried about that long drive, but I'll just have to stop and get out and walk around a lot. The knee still gets really stiff and sore if I don't move, so that's going to be key. And in terms of teaching my Lisa Bug classes, I think once I get down and settled into Florida, we can get rolling with those. I'll let you guys know what'll be first on tap, how many days on the schedule I can start to teach right away, and what formats. So I'm looking forward to doing that. I've been popping into the Y now and then to meet on occasion with a private client for a 30-minute session. I've popped in and taught a reformer class or two, and also popped in and taught a virtual Y class seated in a chair, things that are really easy for me to do with my knee, arthritis exercise, gentle yoga, all things that can be done working around the range of motion and the strength that I have in this knee. And that's all been a really good part of my recovery. So I am coming along. I'm feeling a little bit more self-esteem with where I am now, especially with the doctor saying you're on track, you're doing good, because I really had been feeling I was behind on my strength and on my recovery. So I'm doing okay. Just wanted to let you guys know that, and I'll keep you posted moving forward where I am in my recovery. Thanks for staying along with me on this ride. It's been quite a journey. See you next time, everyone. Take care.